Hi, my name is Anthony Betteridge, and I'll be demonstrating VxMED software. VxMED is designed to teach diagnostic reasoning and is a virtual reality medical education platform. We take realistic patient models and have created interactive scenarios that students can use to learn in a more realistic environment than what is offered by a textbook or a video lecture. These scenarios will be customizable by collaborator authors, and they'll be able to be tailored to the level of the student learner and the desired learning outcomes for them. To give you an example of what VxMED looks like, we'll jump into a case here. And this case is of Stephen, who is having prolonged periods of nausea and vomiting. The first thing you see is a little tutorial on how the user interface works, and I'll just skip that and talk to you about it. So it plays like any modern 3D video game, first-person video game, where you can move around the room and inspect the 3D objects. We actually use 3D scanning to capture our patient models, so they're real-life individuals. And the user can interact with them and the physical exam elements, and then also perform lab tests and other diagnostic tests to figure out what diagnosis is at play. The first thing that is seen is the history of presenting illness, and so the summary of this history is that he's had some sick contacts through his grandkids and as experiencing pretty bad nausea vomiting himself. And we won't go through the content, but I'll mostly talk about the features here. So the differential diagnostic coach is a proprietary teaching aid and tool that helps the students interpret and associate elements of the history, elements of the physical exams, elements of the lab and diagnostic tests with how they should be formulating and changing their mental differential diagnosis. So here's the coach version, and there will be tested versions and other versions where users have to come up with their own differential. Here we see that viral and bacterial gastroenteritis for his presentation are far and away the most likely reasons for his presentation, just based on their prevalence and the history. Next, the student users will be able to interact in this environment where we have case information summaries. Again, we're bringing the textbook information out of a textbook and into these interactive scenarios. So the student now can perform elements of the physical exam, listen to the heart sounds, read when appropriate the interpretation of those sounds, and perform any other elements of the physical exam that have been designated as appropriate for this case. And they're being scored and given feedback throughout the case, as well as seeing, as we see here, this patient has tachycardia, fever, and those elements have changed the differential diagnosis and allow the student to see in real time how the physical exams they're performing are affecting what is likely to be the causing diagnosis. Didactic elements and teaching points can be introduced after any individual physical exam or diagnostic test. And in this case, we learn about the SIRS criteria, which is just one of the learning points that the author of this individual case wanted to teach to the students that he was or she was introducing SIRS to. I won't do a full workup for the purpose of just demonstrating. So once you think you've done the physical exam that's required, you can move on to lab tests. And so we'll just do a few basic lab tests, a CMP, which has a lot to do with this case, and we see that, oh, he has not just some sort of symptom that's causing nausea vomiting, but He's also has a kidney injury going on that we wouldn't have discovered unless we could actually order tests and find out. So his BUN to creatinine ratio is high. Again, more didactic learning points about acute kidney injuries have been introduced at this point for these learners. And these are second and third year medical student learners, but again, these can be tailored to the user. Once, and again, I'll move on. Once you feel like you've done a full workup, and we have not, let's do an EKG just to show some additional capability here. So you can read an EKG rhythm. You can then see the interpretation. And let's go ahead and do, why not, let's do chest x-ray, all fairly normal. Okay. For the sake of argument, we'll skip to finishing this case. And if I'm a student, I'll say, okay, I think I've done the full workup, and I think he's dehydrated and has gastroenteritis. And so you get to pick from this list and choose which elements you believe are appropriate. So we'll stick with that. And you get feedback, and we've learned that we've got some correct and we missed one. He has pre-renal azotemia or an acute kidney injury. As well, you get feedback on essential tests. So we didn't do a urinalysis, we didn't look at his white blood cells, urine toxicology, and a number of other things that the author of this case deemed essential for their students and the level that they're at to get full credit on this case. And they get feedback as to why they should have thought about performing these tests. We didn't do an abdominal exam. Well, pretty important for somebody with nausea, vomiting. So this to give you an example of that. Following the feedback, you can introduce a series of multiple choice questions. These can also be triggered by different elements in the case. So if this one, if we had performed a urinalysis and a urine sodium creatinine, we would have been prompted to analyze it with this multiple choice question. And I'll just skip through these here for the purpose of demonstration. Again, some management elements can be introduced as well at any point in the case through multiple choice questions. The cases are scored, and scores are saved to the database, can be reported to institutions or just saved on the user's profile. And as they gain experience points doing proper workups and learning about how to diagnose patients, their user profile will advance in level, and there are a number of other gamification elements that are incorporated into VxMED learning scenarios. At the end of the case, any didactic elements that weren't discovered interactively come up, so we didn't do all of our workup, and here we can learn about some of those elements that should have been introduced in the case. We can also see an overview of this patient's presentation. He has nausea, vomiting, he had sick contacts, tachycardia, delayed capillary refill, and then obviously some electrolyte and creatinine problems due to the acute kidney injury. A number of other elements that are useful and can be used to study or to help as a user is thinking about their case. They can use outside resources and bring in point of care tools. For example, if I wanted to learn about acute kidney injury, I could do so and use that knowledge as I work through these cases, similar to how real-time physicians use point of care tools with actual patients. Again, my name is Anthony. We're creating these VxMED clinical scenarios for medical learners of all levels, and we're excited to adapt what we have to the needs of the Air Force and specific training requirements in the various Air Force training programs. Thank you so much, and I look forward to working with you more.